getting Botox, maybe a bit of stuff in my forehead or some filler in my lips. I don't know what the long-term effects of that is. Can she explain that a little bit?
Hi, Alana. Thank you so much for that great question. So let me first start with Botox or anti-wrinkle injections or wrinkle-reducing injections. That seems to be a topic on the tip of everyone's tongue, but it's actually been around for a long time. It's been used cosmetically for over 30 years. So actually we do have quite a lot of long-term data on the safety of it. Some people don't realize this, but actually it was originally being used for a lot of neurological conditions. And one of the conditions it was used for initially was people having a thing called blepharospasm, where they were getting spasm around their eye. And that is a really troublesome neurological problem. And initially they were using Botox injections around the person's eye to reduce that spasm and allow the person to be able to not have pain in their eye and also for their eye to function normally. And what they noticed was that people who had those injections had very smooth forehead on that side. And the patients started coming back and asking the treating doctor, hey, I'm really happy about what you've done for my blepharospasm, but actually, could you do it on the other side as well? Because I'm really loving that I've got this smooth forehead. And that was the kind of origins of beginning to use this toxin to cause relaxation of the muscle and therefore reduce the wrinkling effect that you have naturally. So basically it has a long history. It's definitely very, very safe. Sometimes people get a little bit confused and think that they can end up with botulinism, but basically you can't. So the doses are absolutely tiny. However, that's not to say I genuinely believe that it is a procedure that should be carried out by someone who really knows what they're doing, because it's very, very easy to potentially have untoward consequences that you don't want to have. And they are things like having, drooping of your eye, or feeling like you've got, a startled look about your face, or having your eyebrows look a little bit strange. So in terms of long-term implications, look, there really doesn't seem to be any. As I say, we've had the data for quite a long time, and it would seem that the main long-term consequences is that people who've had these injections for a prolonged period of time seem to have a lot less wrinkles. So most people would consider that to be a bit of a positive impact. Obviously, there are also short-term risks, and I have already mentioned some. So sometimes you can get a cosmetic outcome that you're not going to be delighted or happy with. And the reality is that it does take a while for that relaxation that has been caused by injecting that toxin. It takes a while for it to kick in, but it also takes a while for it to wear off. So if you don't love the results, then the reality is it's probably going to take, anything up to 12 weeks for it to completely come back to normal. One of the most annoying consequences or potential risks with using these injections are to get a droopy eyelid. And that can be obviously extremely annoying for someone, because if your eyelid becomes very droopy, then you're not going to be able to see clearly. It might impact your ability to work or drive. The reality is that consequence is not common, but it's not uncommon. It's definitely a real risk. The good thing is, if you are unlucky enough to have that happen, it tends to be a short-lived consequence. So maybe will persist for 2 to 3 weeks. There are some special prescribed drops that you can be prescribed and that may help, or your doctor may also be able to do another type of injection that may also help reduce the consequence. But really, those are the kind of negatives of having anti-wrinkle injections. It is a very commonly repeated procedure, and patient satisfaction is extremely high with these injections, because people like the response, and people tend to really like it, particularly on their frown line, or on their forehead or crow's feet are probably the commonest places that I see people asking for those injections. So the other part of your question was about a completely different type of injection regarding lip filler. And what people will notice in Australia over the next little while is that unfortunately, because of TGA and APRA rules for doctors and nurses in Australia, it's becoming increasingly difficult to talk about these things in any kind of advertising material. And so you will see people just talking about, I have treatments that could help enhance or plump your lips, but you can't actually use a lot of the terms that were previously used. So trying to find information may mean that you have to kind of go back through older videos, and you might even have to look outside Australia to find what you're looking for in terms of educational content. And that's just because we've had some new rules put in place. But anyway, back to your main question, what are the risks? Well, obviously, if you were to have filler done in your lips, I'm not going to lie to you, anyone putting a needle anywhere near your lips is going to sting and it's going to hurt. So you're going to want someone to use some numbing cream on you, ideally, so it's going to numb the pain. The next thing is that you're probably going to be nervous, and the person's going to need to be someone who can put you at ease and relax you so that you can sit and allow someone to work around your mouth area. I think the secret with lip filler is to go and not have lots of preconceived ideas, or not particularly attached to a photo of a celebrity, for example, because you actually might have a completely different type or style of lip. And believe it or not, we've got different names that we call different lip shapes. And the kind of lip that you want because of someone you've seen on a picture may not actually be possible for your lip shape. And in fact, something completely different may suit you. I think the other thing with regards to lip filler is, go really low and slow. So sometimes, because we're talking about small volumes of product, sometimes people think, oh, 1 ml, that seems really small. That's just like a fifth of a teaspoon. And that's not very much. I want more than that in my lips. But believe me, even 0.5 ml in lips, in a certain lip, can be more than enough. So I think you want to really take your time, think really carefully about what it is you're trying to achieve and why you're trying to achieve it. And I think it's also really important that you go and see a practitioner that you trust and that you like their aesthetic or the look that their patients seem to be achieving, because there's definitely some clinics out there who go for a very dramatic look, and then there's other clinics who their patients are really into a very subtle look. And I think you want to be really choosing where you go in terms of what outcome you're looking for. The thing about we use a hyaluronic acid filler to fill lips, or to put into lips, and you do get an instant result. So it is a little bit different to the anti-wrinkle injections that I talked about earlier. The anti-wrinkle injections take days to kick in, whereas you will, walk in with your lips looking one way, and then if you have your treatment, you'll walk out with your new lips. However, I will put a caveat to that and say that your lips will be more swollen as well. So the final result is likely to be somewhere in between. And the main complications with filler, or the main risks of filler, obviously, as I said, were the things like, your lips hurting. Someone puts a needle into your lip is absolutely filled with blood, muscle and engorged tissue, so the risk of getting a bruise. So although you can definitely have lip filler and have no bruising, you have to always sort of prepare for the worst and then hope for the best. So you definitely wouldn't want to have lip filler, I don't think, and then be going to like a wedding the next day or something like that, because you may have some swelling. There obviously are some people out there who can end up with, anytime you breach the skin with a needle, you can end up with an infection, you can end up with a reaction, you can end up with a nodule, and you might just not like the result. The good news is that with filler, you can use another product to dissolve most fillers, so you can go back and have it reversed if you would like to. But basically, in summary, I think that all of these treatments needed to be treated with the respect they deserve. They are medical procedures. I don't think that they're something that you should go and have on a whim. think there's something that you should think about. You need to understand that there are potential consequences, and sometimes they can be serious and potentially, life altering, and therefore you always want to know that you are going to somewhere that's really safe, safety conscious, and that you feel comfortable that they are on the same trajectory as you are in terms of that you both want the same outcome. Alana, I hope that's answered both your questions today, and hopefully some of the listeners will have gained some knowledge as well. This podcast and any information, advice, opinions or statements within it do not constitute medical, healthcare or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.